Good morning. Welcome, everyone. Thank you so much for being here for Mario Espinoza Kulick's dissertation defense. It's just been an honor to have him as our student. And I just want to say a little bit about Mario and the strength of his character and his resilience. You know, I met Mario when he was an undergraduate student. He invited me to San Luis Obispo, to the university there, and to have a conversation on social justice in the community. And that was a long time ago. And Mario just persisted. He kept moving forward. Ended up coming to UC Santa Barbara to be a graduate student here, and has done extremely well, both academically, personally, and also community-wise. So he's just such a great shapeshifter. He's an individual that's able to navigate multiple worlds. And in each world, le echa muchas ganas. He's always doing great in all the worlds he's in, just working as hard as he possibly can. So we're so thrilled to have him here. We've talked as a committee in the other room, and we're of course thrilled about his project and looking forward to the conversation. I want to welcome the rest of the committee. We have Professor Verta Taylor, who's there in the background and ready to ask her questions and make her comments about Mario's dissertation. We also have Professor Edward Reyes in the background there, also ready to have a conversation. And finally, I'm Victor Ríos, and I'm the chair of Mario's dissertation. So thank you all for being here. We're excited about this conversation, and so let's get it going. Okay, so Mario, the first step, just to let you know, everyone, audience, is that Mario will present for about 20 to 30 minutes on the project. After his presentation, each committee member will ask a question and make some comments. Mario has an opportunity to respond to those questions and comments. Then after that, we'll open it up to questions from the audience. The way I would like for the audience to ask a question, if possible, you click on the reaction button on the bottom right there, and you click on raise hand. But if you're not able to, that's okay. We'll figure out, you can put your question in the chat. And we'll figure out a way to get to your question. If there's time, we go through another round of questions with the committee. If there is no time, the committee just goes off and deliberates. And Mario, what we'll do is you can just send the committee to a breakout room, if that's okay with you, towards the end. And then we'll return. And once we return, we will announce the decision to Mario and the rest of the group in the audience. Okay, wonderful. So let's begin. Mario, please take it away with your presentation.
Alrighty. Thank you so much, Dr. Victor Rios, and all my committee members for being here, friends, family, colleagues. I really appreciate you. And my talk today is called La Gente Unida, Latinx Immigrant and Indigenous Health and Advocacy on California's Central Coast. My name is Mario Espinoza Kulick, and my pronouns are he, él. I'm a PhD candidate at the University of California, Santa Barbara in sociology, and a health policy research scholar with the Robert Wood Johnson Foundation. To start off this talk, I'd like to begin by outlining some of the motivations behind the work. As many of us have probably noticed, the previous administration stressed a lot of attention on anti-immigrant policies and racism in the United States. There's been a rising political xenophobic hostility against Latinxes and indigenous immigrants. Stereotypes like being greedy, lazy, or invasive to US society are harmful to our community and have led to harsh policies like child detention and family separation. We've also seen how these policies impose negative health behaviors and effects. One impact is over-reliance on emergency services and disenrollment from public benefit programs. We've also seen how exclusive policies perpetuate these inequities in health among families and communities. Of note, the public charge rule has been a main contributor for disenrollment from programs like Medi-Cal and assistance and assistance for women, infant, and children. Restrictive eligibility policies to government-sponsored health programs are also a deterrent from accessing healthcare. Unfortunately, we've also seen a rise in violent enforcement tactics like raids and immigration customs enforcement agents and collaborations with local law enforcement officers. To guide this study, the indigenous social determinants of health theory was used. This theory is used to communicate that health is a holistic concept that extends beyond individual behaviors and genetics. This is something that indigenous peoples have always known. When compared to Western definitions of social determinants of health, indigenous people have included unique structural determinants like history, political climate, economics, and social context. Indigenous peoples have always taken a holistic view, including things like racism, colonization, self-determination, the land, and control of resources as determinants of their own community's health. Another motivation for the study has been the rise in health disparities during COVID-19. Studies have shown that Latinx people are more likely to contract COVID-19, and the mortality rates of our community are nearly twice as high compared to non-Hispanic whites. Structural racism created the conditions for Latinx communities to be vulnerable to the pandemic by influencing who had access to care and what opportunities and resources were available to this community. Due to the high concentration of Latinx folks in essential work, there's a heightened risk of COVID-19 exposure. And these risks are even worse when you consider how accumulated stress contributes to increased risk for serious complications. Persistent barriers like language access, a lack of trust in the medical system, and a culture of fear make it difficult for Latinx immigrant and indigenous communities to access needed care. Zooming out a little bit, this map shows how COVID-19 has affected Latinx folks in California by county. We can see that there's an overrepresentation in the areas that are deep red. And for this study specifically, we focused on the counties of Ventura, Santa Barbara, San Luis Obispo, and Monterey. And these are among the most affected areas of COVID-19 cases among Latinx communities in California. COVID-19, like other issues in health, has led to many forms of social movement organizing and advocacy. And scholars have described health movements as the most efficacious form of activism. This study builds on and extends the literature on immigrant rights movements, which have typically centered citizenship and legal advocacy. Immigrant health movements include a focus on cultural, political, and economic issues that involve a range of institutions. The research questions that guided this study were, what are the characteristics of Latinx and indigenous health movements? What health conditions are of most concern for these groups? How do they impact healthcare and health policy? What roles does culture, specifically indigenous languages and cultural practices, play both in health and healthcare advocacy among immigrant health movements? The project, Gente Unida, Immigrant Health and Advocacy, has focused on these health disparities head-on. The research was conducted through multiple methods, including a survey of health needs and assets, and a content analysis of news data that involved a systematic sample of 4,768 newspaper articles from the Central Coast. Qualitative interviews were held with community members and advocates, as well as focus groups. From the span of September 2018 to September 2020, I participated in observation of in-person and virtual events related to health, immigration, and policy. In writing the results from the study, reflexivity has been a key work ethic. I always continue to reflect on these experiences every single day to see whether or not the writing is accessible and doing justice to the work of advocates and community leaders. To keep folks in the loop throughout the process, I created a public-facing website to disseminate reports, recruit participants, and to be transparent about the work that's happening. At each step of the way, this project at each step of the way had community members involved. Key informants helped to design the study. spread awareness about the project, and set priorities for data analysis. I'm really grateful for these collaborations with community members. Without you all, this would not have been a reality. To ethically work with Latinx immigrant and Indigenous communities, I designed a framework for decolonial-inspired research methods. Decolonial methods deconstruct Western research methods and privilege the voices of Indigenous knowledge producers. They also focus on the margins to explore what's not being heard and what's not being spoken in the struggle. Linda Toy Smith defines the 5 dimensions of struggle for decolonization as awakening, reimagining, intersectionality, disturbance, and structure. The framework inspired my own research methods that focus on reflexivity, to be aware of the conditions of settler colonialism, collaboration with Indigenous experts, sharing knowledge in public, listening to and acting on community advice, and assessment of ongoing research norms. Awakening is the effort required to critique the status quo and identify actions that are needed to make change. This is put into practice for decolonial-inspired methods through reflexivity, which allows us to continually awaken to see the ongoing realities of settler colonialism and erasure of Indigenous peoples. Reimagining means repositioning the role of Indigenous peoples in this world. Tribes, nations, and communities cultivate intellectual leadership and recognize their own experts, who may not be validated by academic institutions. To form authentic collaborative relationships, Indigenous experts must be valued in their own terms. The strength of difference in knowledge production comes from the ability to inspire action across institutions and sectors with an intersectional perspective. To facilitate this, sharing knowledge allows research to be open and transparent for a broad set of key stakeholders. We can also hold researchers accountable by soliciting community advice from recognized community experts and directly affected individuals. For this advice to be meaningful, it must be given real weight in decision-making about research design, analysis, and dissemination. Relative to the 4th dimension of decolonial struggle, disturbance, this creates opportunities to understand how groups change and priorities shift over time. The broadest practice of decolonial-inspired methods is to critically assess how Indigenous peoples and indigeneity are being neglected in research and broader society. This is motivated by the struggle against existing structures that reproduce inequity and marginalization. Now, taken together, these practices are not sequential or hierarchical. They all hold equal importance and may be repeated throughout the practice of creating and sharing knowledge through research. The survey of health needs and assets provided information about Latinx immigrant and Indigenous community members that's not typically assessed in large-scale efforts in public health. As with the larger study, community stakeholders were actively involved in the survey process. In addition, I consulted with experts on survey design to get an effective survey of health needs and assets on the Central Coast, with a total of 177 eligible respondents completing the survey. This included a majority of respondents who identified as a hybrid of both advocates and community members at 59%. The remaining sample included advocates who weren't part of the community at 22%, and community members who did not actively advocate at 19%. The survey data collection happened between September 2019 and September 2020. And this included responses both before and during the COVID-19 pandemic. In terms of the sample, the majority was 82% women and also included Spanish speakers at 46% and Indigenous respondents at 17%. Some of the pressing disparities we observed in the survey included Indigenous respondents that Indigenous respondents had more difficulty accessing hospitals, sexual health services, and even public transportation on the Central Coast. All 3 of these differences show that they were significant with p-values under 0.05. This pattern of access disparities reflects how Indigenous peoples are continually underserved and excluded from opportunities to be healthy. The community also voiced the importance of language barriers. Latinx communities are not a monolithic group, they're a heterogeneous group, meaning that we're not all the same. We consist of a diverse group of peoples with a diverse variety of languages. Interview participants actually indicated that Indigenous language interpretation was a key need for meaningful health access. For example, one participant said, even if we fight for policy that encompasses undocumented individuals, we also have to think about the practicality of implementing those policies and how we actually reach our language minority families or our communities that don't have a written language and only have an oral language. Another advocate stated, we don't really have anyone that speaks Mixteco, but we do have someone at the clinic. When we do encounter someone, we do tell them that they could call the clinic and that usually, I believe, the receptionist or the medical assistant, they speak Mixteco. So it's important to have multilingual interpreters for our community members that may not speak English or Spanish. Another concern voiced by the community was mental health. To examine this more closely, an ordinary least squares linear regression was used to identify significant factors that were associated with generalized anxiety disorder using the GAD-7 scale. The independent variables in the model included being an immigrant community member, whether or not folks spoke Spanish or English, whether they were Latinx or Hispanic, and if they were Indigenous. There were also variables around healthcare context that included whether or not they had insurance, whether they trusted their biomedical healthcare, how much they trusted therapists. And in addition, variables for risk and protective factors were mental health knowledge, concern for mental health, and experiences of discrimination. In terms of anxiety among Latinx immigrants, 4 predictors were statistically significant. They were being insured, mental health knowledge, concern for mental health, and experiencing discrimination. Being insured accounted for a 0.47 point increase of anxiety symptoms on a 3-point scale. The one factor that decreased anxiety was actually having mental health knowledge. It accounted for 1.05 points on a 3-point scale. Being concerned for one's mental health increased anxiety by 0.55 points. And similarly, experiencing discrimination based on immigration status, race, ethnicity, gender, or sexuality accounted for a 0.76 increase in anxiety on a 3-point scale. Based on these findings about drivers of anxiety scores, recommendations from this study are to address mental health concerns for Latinx immigrant communities using the pyramid model shown on the screen. This model was inspired by the World Health Organization's optimal mix of services pyramid. It's important to have multilingual and structurally competent care in the 4 levels of the pyramid that go from bromathoraxes and community health workers, primary care mental health services, advanced health providers in general hospitals and community mental health, and specialist psychiatric services. It's also important to have trauma-informed approaches for specialist psychiatric services and our advanced health providers in general hospitals and community health. The bottom of this pyramid emphasizes that self-care and the expansion of public health insurance to undocumented individuals are a crucial foundation that everyone needs in order to have access to mental health care. While I was on the field, I read a lot of newspapers, and from those newspapers came this analysis around the Latino threat narrative. Ethnographic news data in the amount of 148 articles were identified through conversations with key informants, regularly reading the news, downloading articles shared by advocacy organizations on social media. And then what we did was take over 4,000 newspaper articles published on the Central Coast between 2006 and 2020, looking across 10 newspapers on the Central Coast. The first search included articles that mentions immigrants, or immigration, along with the terms health, public health, illness, sick, or sickness. The second search included articles that mentioned Border Patrol, Customs and Border Protection, Immigration and Customs Enforcement, or deportation. The systematic sample was then used to conduct a computer-assisted analysis to examine how the topics related to one another using R. For folks who don't know, R, the letter R, is actually a data analysis software that's open access. The topics that were most central to other topics were Latino threat narrative, politics, policy, and illegality. Latino threat narrative reproduces racist beliefs about Latinx communities with stereotypes backed by words such as influx, surge, alien, and invaders. And so if we think about the figure on the left over here as the way someone's eyes work, it shows when you look out, the information you gain from that visual data is being filtered through a lens of Latino threat narrative right here. Both policy and politics communicate a message that Latinx communities are a threat. They're connected. And through that message, the social construction of illegality affects how news is constructed and then disseminated. The same news that maintains this link between Latino threat narrative and negative health behaviors continues across generations. This demonstrates what Pedraza and Shu in 2015 found to be a chilling effect for immigrant communities. This means that folks are paralyzed and forgo accessing opportunities for a healthier life. From the advocate's perspective related to this data, immigration policy news is directly related to health. They had said, what we've noticed actually is a drop in the amount of clients that come to our office when ICE is in the news. Normally, our waiting room is pretty packed and there aren't any seats available. And lately, people have been coming into our office. Also, like I mentioned earlier, we have those community women's classes, and normally there's a high turnout. It's like 50 people, but now only like maybe 10 or 20 will come. That is because of ICE and all these talks of raids, but it's also because of the public charge discussion that's been going on. I think people are just really scared. Relatedly, an advocate interview explains, my clients see it on the news and hear on the radio, and they've had experiences where people are always telling them, no, you're wrong. No, you don't know. No, you don't speak the language. It's like, I've been told this in a million different ways, so it must be true. They don't fight back, and they don't utilize the rights that they have. To combat these negative effects from the news discourse that communicates Latinx folks as a threat and the anti-immigrant policies and racism that these communities face, social movements, especially immigrant rights movements and immigrant health movements, have mobilized essential worker framing. Essential worker framing has been used to advocate for health policy and gain resources and publicity. For example, this led to raises for the strawberry season, as well as mutual aid funds. Movements have also responded to this exclusion from CARES Act funding, like the 805 Undocu Fund. Immigrants were systematically excluded from receiving pandemic aid during the Trump administration, which is why folks needed to take this into their own hands. Advocacy groups draw on pre-existing resources for mobilizing under these hostile conditions with limited resources. They relied on their own people to make masks for their community, communicate about vaccines, and communicate about personal protective equipment. They also mobilize as a community as we face this pandemic. One organizer shared, nuestra estrategia es más que nada seguir insistiendo, seguir tocando puertas por puertas, seguir insistiendo, dándoles la información correcta. Hay muchos recursos de los que ellos se pueden beneficiar. No importan las opiniones políticas, hay mucha información, muchos beneficios. Eso nos hace más fuerte. Translated in English, this says, our strategy is more than anything to keep insisting. Keep knocking door by door, keep insisting by giving them the correct information. There are many resources for their benefit. Political opinions don't matter. There's plenty of information and many benefits. This makes us all stronger. We see this strategy through community education. Advocacy groups have shared information about pressing health inequities and policies, breaking down language barriers in the process. For example, groups translate from Spanish to Mixteco and make materials accessible, not only in English, but also in Spanish and indigenous languages. We've also seen artistic expression by our young people communicating the importance of social distancing to protect each other and maintain our community health. These community-led materials are culturally responsive and center youth voices. One advocate shared, language is a huge barrier. Mixteco, there's not only one variant, there's, I believe, 20 to 23, if not more. Yes, it is a big barrier, but that's why there's organizations like 805 Undocu Fund or MyCop Mixteco Indígena Community Organizing Project, and Importa. We had to hire a new staff person that speaks Mixteco to be able to explain things about immigration, at least, and other things. Yes, that is a huge barrier, but hopefully with this whole situation that we can all collaborate, or more young people that speak Mixteco can work in these spaces. That's my hope for the future, and I think that'd be very awesome. Solidarity and health policy were very important to immigrant health movements in the summer of 2020. We saw a rise in anti-Black racism. In response, immigrant and Latinx community organizations, especially Mixteco Indígena Community Organizing Project, expressed their solidarity with the Black Lives Matter movement by not only sharing their materials, but also translating them to communicate the importance of appreciating Black lives and showing up in solidarity with our communities of color. Policy victories like better pay, working conditions, and access to personal protective equipment have been gained, as well as increased housing and health protections to combat COVID-19. At the beginning of 2020, there was also the expansion of Medi-Cal to undocumented young adults up to age 26. Just this month, California Governor Gavin Newsom released his budget proposal, including Medi-Cal coverage for eligible undocumented elders age 60 and older. However, Health for All Seniors was also included in the 2020 budget until it was removed in final deliberations. On a more local level, in Santa Maria, farm workers had received a raise after over a month of organizing. These efforts included launching an online petition, which gained national attention and resulted in over 61,000 signatures. It's very important to note that even though they've gained a raise of $2.10 per box of strawberries, there's still a lot of produce that has not been given an overdue raise for our farm working communities to thrive. During the time of organizing, farm workers were targeted for retaliation by their employers. In collaboration with Cause, over 212 farm workers actually received settlement checks after facing that retaliation, and farm employees were educated on labor rights. With all of this taken together from the advocates, the advocate community members, and the community members themselves, we've seen the story of resilience and advocacy. We've seen how movements have translated their materials and interpreted key information for their constituents, provided direct support, funding, and services, and have even advocated for policy or systemic change. In the face of vulnerabilities and disproportionate negative impacts of COVID-19, advocates have demonstrated high levels of resilience in serving our communities and fighting for change. In conclusion, decolonial-inspired methods are useful for engaging with community collaborations and producing tangible outcomes like op-eds, community reports and presentations, a public website, and also collaborations with community members, nonprofits, and partners, and direct service to communities and Indigenous peoples were used to engage with the community and make this an effort that truly resembled the name of the study, Gente Unida. Structural racism intersects with xenophobia and settler colonialism and produces unique vulnerabilities for Latinx, immigrant, and Indigenous communities. These barriers included not having access to insurance, language barriers, and mental health. Latinx immigrant health movements have also responded to the pandemic by mobilizing for systems change at every level. This results in greater access to health resources, adapting in the face of pandemic conditions, and advocating anti-racist change systematically. Some policy recommendations that come out of the study are to expand public health insurance to include folks of all ages, regardless of documentation status, to support language access, translation, and interpretation, and to affirm that racism is a public health crisis. For all of us, recommended interventions include to build our healthcare capacity on the Central Coast with a lens of equity. At the local level, we also need to disallow coordination between county sheriffs and city police with immigration and customs enforcement. To further decrease discrimination and xenophobia, we can promote implicit bias and anti-discrimination trainings throughout our community. Finally, our community needs to create supportive pathways for underrepresented young people to pursue careers in healthcare and policy. But together, I know we can do it.
Thank you so much. Thank you, Mario. That was a powerful presentation. Wonderful, wonderful work, beautifully done. And we will talk more in detail about the specifics of the value and importance and significance of the work. So I'll get right to it and ask the committee. For the rest of you in the audience, please have your questions ready. We'll have time for a few questions from our audience members, and you can go ahead and put them in the chat, or later on when I call for audience members to ask questions, you can go ahead and do the raise your hand function there on the bottom of your screen. So I want to open it up to the committee. I'll start with Professor Taylor with any comments or questions. Oh, let me figure out if I can unmute you. I'll ask to unmute there, Professor Taylor. All right, there you go.
Mario, I want to congratulate you again, which I already did in writing, but I want to just say a few things about what makes this project so special, and just thank you and commend you for doing it. First, well, the data collection is very ambitious. The amount of data you collected, especially during such a challenging time for data collection, is very impressive. Secondly, your engagement with and respect for the participants is very admirable and a model, really, I think, for the kind of work we should be doing as sociologists. And of course, the impact then that this project is going to have because of your respect for the participants and engagement with the community, I think, is exciting. So what I want to focus on here are really two things. One, I want to talk a little bit about the contribution to social movement theory, because you also have made some important contributions here. And secondly, I want to talk a little bit about the big question about, how we're going to make change in light of the kind of structural changes going on in the country. Let me talk a little bit about the second one first and ask you a question. I was thinking as you were talking about what has happened to mental health care delivery in this country over the last, say, 40 years. And how I was thinking about it is that my dissertation focused on the delivery of mental health services to Xenia, Ohio, following a massive tornado in a community that was the site of the Underground Railroad. The federal government gave millions of dollars to that community to provide mental health care services, and it was the first such project of that nature. And I was involved in kind of an evaluative study of whether those services made a difference. In fact, I presented my dissertation findings at the annual sort of public meeting of the Mental Health Society in the community. It was so much like the work you're doing now. But the difference is, at that time period, the federal government was offering all of this money for mental health care services. And what you're telling us here is how important mental health is, as well as physical health, and how the two are correlated. We know they're very closely related. So in a way, what I see your work is doing is really trying to push and press. It's another one of these projects I'm seeing people doing for us to respond to this real absence, of any kind of public commitment to mental health care services. It's certainly at the federal level. I mean, with the disbanding of the Community Mental Health Centers Act. And since this, it's gotten even worse. So can I ask you, kind of as an expert who's on the ground here now, do you see any possibilities for change, or is it all going to have to be picked up by the states and at the local level?
Thanks for your question, Dr. Taylor. I definitely see that there is an opportunity for mental health services to be bolstered by lots of this surplus funding that the governor keeps tooting about, but also in thinking about structurally how even folks as like teachers and in the districts where schools exist, mental health services could be more integrated in their services to our youth, but also thinking about our adults, right? We need to the difference between not having funding and having funding is a big one, right? If you have funding, you're able to have support and staff and translation. But without funding, you're able to raise awareness and share resources and do a lot of these community aid tactics as the social movements in this study had done. So I really think that there is a chance that we are going to see more change in the mental health arena, especially thinking how crucial it's going to be post quarantine, right? There's a lot of things coming up for people who are have been immunocompromised and have just barely began to go out their doors. And I believe people are going to start to need to pay attention to that. But to answer your question, I do believe that there is an opportunity, at least here in California, to expand and transform the way we deliver mental health care services.
You know, because I was also thinking about, I mean, since another one of your areas is race, how closely this is related to the expansion of police, because the police have so-called taken over some of these mental health functions. You know, they're called out when people are having breakdowns and having episodes, and we see that that obviously has not worked very well. In fact, it's been detrimental. It's resulted in horrible outcomes. So what I'm wondering is if maybe we see these as opportunities, right, to expand mental health care back out, you know, bring it back out into community control in a way that we've lost once the police began, you know, to be expanded to take over these kinds of activities.
I appreciate that because, you know, this month is Mental Health Awareness Month, and Mental Health Action Day was actually last week. At this youth mental health first aid training, I learned that you can actually request through a dispatcher to send a mental health team instead of the police. And so I think that's something that a lot of people don't know about, and oftentimes does not happen because we see all this violence, especially around Black men with mental disabilities, resulting in death, right? We know that folks, like the way that responders who are local law enforcement respond to mental health issues, they're not as prepared as a mental wellness specialist, right? So we need to also emphasize and show and spread the word, right, that you can request for a mental health team. But the problem is if there's not enough funding to for mental health teams to be present at every crisis.
Good. So I don't want to dominate, but I want to ask a couple of quick social movements questions too. One of the things I think I learned from your dissertation, and tell me if I've kind of misunderstood, but is this notion of essential workers as coming out of the movement itself. Is that true? I mean, when you talked about the framing of the movement, you know, all the social movements have a framing, you know, for their identities and their importance and what brings them together and helps them form solidarity. Is this really, did this notion of essential workers really originate among the activists themselves? Or was it some, you know, because I think we now all accept the idea, you know, it's kind of been, it's permeated the media that farm workers are essential workers. This is the claim or justification, you know, for rights to, you know, to what some of the things that they've achieved and, you know, as activists have mobilized. Did this really come out of the movement itself or through interaction between the movement and the state, right?
So I think that it's kind of a mix, right? So before the pandemic, people weren't relying on always essential or essential workers or frontline responders as a frame for policy advocacy. So I think that the state sort of set these words out of like, who's our frontline response? Who is essential work in terms of guidelines for quarantine? Who can stay home? Who doesn't need to stay home? Who has to show up for work? And then folks who work with the community, especially like CAUSE, for example, they are actively using always essential or essential workers in their framing, right? As well as Líderes Campesinas, MyCop, and a lot of these different Central Coast organizations. Essential work has been embedded in the way that they advocate for their stakeholders, right? Because primarily stakeholders for these social movements are farm workers, are laborers, are people who are represented by unions like domestic workers. And I think that because they were the conversation and the exception to the rule, they used that opportunity to sort of use this master frame put forth by California and other like places like the CDC to use it for their own benefit, because they were being excluded, even though they were being honored, right? Being honored as someone who is always essential, although not reaping the benefits that people who don't have to go to work do reap.
So may I suggest this would be an excellent academic article for you to submit to a social movement journal if you think about what you're doing next, right? We could have one more brief question, Victor, and then I'll turn it over. So the last thing I really wanted to talk about is it's kind of pretty timely. You know, this week we have Alden Morris, the president of the ASA, giving a talk, you know, as part of our racial justice colloquium series. And he was the advocate of a position in social movement theory called the indigenous approach, like some 30 years ago, 40. And it was to be a challenge to what was then developing, which was the resource mobilization and political opportunity approach to movements. The second argued that, you know, elite resources and support in the case of the civil rights movement is why the movement took off. In other words, when we had presidential and elite support, the civil rights movement was able to grow where it had been crushed and repressed, you know, by in previous contexts. Well, he argues that the civil rights movement really was able to grow in the 50s and build strength out of the indigenous community, the culture of the community, this pre-existing solidarity through churches and local institutions and organizations. And this perspective was always kind of in debate with this other approach, resource mobilization, political opportunity approaches, which really focused more on the state and its openness, right, and receptiveness to protest. So he argues that, you know, dominated groups can overcome that with their own indigenous community strength. Well, I just couldn't help but think about how your project totally contributes to that argument. And it comes now 30 or 40 years later, Alden is now ASA president, that you really ought to write this up. In other words, and so I just want to say you really ought to write this up in a journal, because you're providing exceptional evidence, really, of this theory, which a lot of us have continued. You know, this theory got a lot of attention. It's one of the reasons he's president of the ASA now, but it was always kind of the poor stepchild in the field, struggling against the political opportunity, you know, resource mobilization approach. So have you thought and see then combining this with your indigenous theoretical approach and the decolonial approach, I can see that this would be a really important contribution to the field. Do you agree?
I agree. I think that there's a lot of value in comparative analysis between methods and, you know, sort of filling gaps that have not been filled yet, right? There has been knowledge that's been created that kind of sets the tone for how mobilizing occurs in organizations and sectors and in movements in general. But there's also social movement knowledge that comes from, you know, the organic intellectual, the folks who are actually participating in those movements on the front lines. And I think that that's the value added from this study, is that the narratives of the community members, the stakeholders, the key informants will then have an opportunity to interact with folks like Alden Morris and, you know, even David Snow, and thinking about how we define social movements and how social movements are, what their use is to actual communities.
Good. Thank you. Well, I really encourage you to follow up along those two lines, because you've got really important work to convey to scholars as well as to the community. And congratulations really on a project that does both. It's really a model project. I'm happy to I feel proud to be associated with it. So I'll turn over now to Eddie, I guess, who's probably next. Is that right?
Yeah, Professor Taylor. Oh, let's get you unmuted here.
Mm-hmm.
There you go.
You hear me? Okay. By now you think I'd get better at this, but congratulations, Mario. It's very, you know, I admire you for your hard work and your commitment, and it's very ambitious. There's a lot of stuff here, and I was thinking of different parts of it that you can develop. Verta's ideas are great. I mean, there's several things, you know, that you could develop. I mean, first of all, you know, I should say that you know, I'm not at Santa Barbara anymore. I'm in Irvine, and so I'm sorry I haven't been that involved. But one of the things I admired at Santa Barbara was the activism on the ground of the Central Coast, and it's work that's done that doesn't get recognized. And it's great that the University of California, Santa Barbara often doesn't integrate itself with that work, but you're helping to do that. That's great. And then and I think in your position as an academic, you can also call attention to the work. So I think kind of a ethnography or in the surveys and all those work that you've done, if you can call attention to that work as a model, I think that's great. I mean, this combination, this work is very rural and urban at the same time. And one of the things about that work that I thought you were going to develop a little bit more, but you didn't develop, because I mean, there's so much there, is the stuff on indigeneity. So I kind of, I'd like to hear a little bit more about where you're going with that. Like, for example, the experience of COVID, and just these issues of access to mental health. What are the, is it just a question of language? I mean, how do you get indigenous more involved in this? I mean, what are their special issues, and how come we don't speak of, I mean, we talk about Latinx, and you mentioned it too, and you mentioned indigeneity more than anybody, but in general, indigeneity is not in the conversation. So I'm wondering if you can talk about that. And then there's the undocumented part of that too, of course, in this Latinx. And I was wondering about access, and I'll just end right here. Access to the stimulus. We know that undocumented didn't get, even though they were the most essential workers, they didn't get access to the CARES, in the CARES Act or the HEROES Act. And if Central Coast did, if they did something special that gave them some kind of a substitute for stimulus support.
Yeah, so I think that in terms of the indigeneity part of the dissertation, a lot of it is just embedded in the process, right? We're working with Mixteco Indígena Community Organizing Project, and having folks included in the conversations. There's not a heavy representation because that's just not the reality of our demographic. But in thinking about more concrete findings, like language was the most important process of finding this, and thinking about how folks were able to communicate during the pandemic. A lot of these things were coming out in English and Spanish, but then after the pandemic, or like before the pandemic, things were English and Spanish. During the pandemic, more resources started coming out in more of a literary form that wasn't really something that was common to my knowledge before actually doing this research, right? So thinking about this one specifically, created by Radio Indígena and Mike Hop, and also I want to say that they were also less trusting of biomedical Western methods, and more reliant on like yerberos and curanderos, or like of the sample in this study, which was only 17%, right? So I think that's another limitation of this study, is that we won't have a lot of poignant facts that are as robust as the majority of the folks in the sample, but we can see important gaps, right, in accessing those services, but also in how can we support sovereignty and meet people where they're at by bringing services to them. I think that was something that was really important, and we could see in the work ethic of the advocates and the advocate community members, is that they work and make contact with Indigenous peoples every day. And they really had communicated and emphasizes language access. But not only that, but the fear, right? The culture of fear that is driven by immigration customs and enforcement and the news. So I think that in a sort of roundabout way, indigeneity is impacted by environmental factors, But specific to your question in terms of what are like the niche findings for Indigenous participants, a lot of them had to do with access disparities and simple like sort of comparison rather than right like a multi-model support.
Any other comments or questions?
Just the question. I was just curious about the whether the Central Coast had any, and what did they do about the lack of HEROES and CARES Act stimulus support for the undocumented? Did they do?
Yeah, so for the undocumented community, the 805 Undocu Fund responded to the exclusion of the like federal funding by raising $5 million and then distributing $5 million, right? So like in terms of the sample, to participate, you had to be part of the immigrant community, which included being undocumented or a dreamer or a resident. And so the folks who are majorly affected, like this study includes folks who are undocumented because it centers folks who are undocumented, and that's the inclusion criteria for the study. Not asking directly, are you undocumented, but are you part of an immigrant community? And what movements did for folks who were undocumented is they created masks, they raised money to then self-distribute among the community in the Central Coast. 805 Undocu Fund ranged from Ventura to Santa Barbara counties and addressed that. In San Luis Obispo and Monterey County, they had less success with mutual aid funds, while they had probably hundreds of thousands of dollars raised for slow undocu support. And are still working on distributing that money and raising more money, while within the span of a year, 805 Undocu Fund was able to raise $5 million to support undocumented families. So I think it's also a matter of what geographically, what location is more supportive and aware of their undocumented families and community members, as opposed to a more affluent and white counties like San Luis Obispo.
Thank you, Victor. Hey, Mario.
Thank you. Okay, I'll ask, make my comments and ask my question now. And I just want to start by saying that this is a truly impressive and brilliant multi-method translational research study. You should be very proud of yourself, Mario. Typically, people like to specialize, right, in the academy, and so they'll do a really wonderful ethnography, and that in itself is it's an incredible project. It's worthy, or a major interview study, and that in itself is an incredible project and worthy of a dissertation defense. And other folks will do like a survey study and analyze the data. And you did it all, right? You triangulated, you brought in multi-methods in a true interdisciplinary way. And I think that's the future of sociology. That's the future of the academy, bridging, not so much, oh, I'm in this discipline and so I'm gonna use the tools of this discipline. But instead, I'm looking at the community. What are the needs of the community? How can I understand the various challenges and opportunities out there? And then how can I use various tools without any limitations to answer these questions? And so you did an incredible job at going through this exercise. In addition, you're one of the few scholars I know, and scholars meaning from grad student all the way to full professors, that actually persisted in their research during the pandemic. A lot of people could not, right? And that's not their fault, but a lot of people could not persist in their research during the pandemic. A lot of stuff happened, but somehow you found a way to navigate through the pandemic and still try to understand what was going on in the field with folks. And that's going to be very important as you move forward, because there's like this void of data across the board in the academy, where we had a lot of data in social sciences, a lot of data on what's happening with human beings and social process and community efforts. A lot of data, the pandemic hits and then data disappears. And so because of that, your work is even more important because you have the information of what was going on during the pandemic compared to what was going on before the pandemic. So I'm wondering, that would be the first question. I'm wondering what comparison studies you have in mind to really show what the pandemic did, not just in terms of victimization and detriment, but what you show us is, you know, brilliantly going through the Latino threat narrative and then ending the project with, but look at what the community does when it gathers to fight that Latino threat narrative, to fight, you know, a lot of these processes that impact them, like predictors of anxiety, for example, where you found, you know, like it's fascinating, the insurance question, right? Why is it, right? And so using the qualitative data to try to understand why is it that we get more anxiety when it comes to, when we're supposed to be covered by health insurance, we're supposed to feel safe, you know, and explaining that in an article would also be incredible. And again, this changing the narrative from not just a dissertation or project that reports on how communities are victimized and oppressed, but also reporting on how the community then takes on this oppression and victimization through a decolonial approach and ends up being able to provide some very unique pieces of information and action that could inform true community and structural change. And so that third question would be then, the second one was about, of course, you know, the notion of moving from victimization to agency, and how you were able to do that so smoothly. But then the third piece is, how do we bring, and you have a policy proposal at the end there, recommendations. What in your mind is the next level in terms of approaching this policy change? Who do you bring this policy change to? Who do you go to first? Is it the local, you know, politicians? Is it state politicians? Is it police departments? Is it hospitals? You know, and I know you're not going to do it alone, right? You have a whole community you work with, but who do you go to first as a collective in terms of presenting this information in a way that each of these stakeholders can see as useful for them to make the appropriate changes with?
Yeah. So for the first part of the question, I think that there's a lot of directions we can go because there's this pre and post data available to us. So I'm thinking about you know, what you had brought up, the mental health component, right? There's definitely data before COVID that might be different, right, from what they were experiencing in terms of discrimination, and what protective factors there were and how it compares to during the COVID-19 pandemic. Did it get better? Did it decline? Was racism and discrimination a bigger factor or during the pandemic or before? But there's also the data on appointments not being available. Consistently before the pandemic, there were really high levels of not having available appointments, like at 76%. And then during COVID, the appointments not available kind of reduced, but at the same time, it was supplemented by appointments not available because of COVID at 24%. So there was that sort of consistent appointments not being available before and during the pandemic. I think for your second part of the question, there are a lot of different ways we can go here. I think that the federal government has been doing some internal discussions in the COVID-19 task force, like growing mobile healthcare capacity. And then that has even now trickled down into the counties and in mobile vaccine clinics, right? And pop-up clinics serving farm working communities and indigenous groups. I mean, just last weekend, I volunteered with Cause to at a pop-up vaccine clinic, right? So I think that the answer is that the levels are very important to consider in terms of organizational change or policy change, right? Community-based organizations have been doing a lot for our stakeholders and community members, and as opposed to like county officials and elected officials and the governor, right? So there are these longer processes in litigation and deliberation of policy that can trickle down into more funding for these organizations that are already doing the work. So I think the answer to your question is meeting the community where they're at and what priorities they want to set, which is what we did with the focus groups. We had directly asked the folks in attendance, what do you want to see be done with your data? And was encouraged to like interact with people at all levels. So I had contacted folks like Salud Carbajal, who is our House representative, and all of our county board supervisors were involved, City Hall in Guadalupe, and I mean the city council members in Guadalupe and Santa Maria. So like every level of government was engaged with this work, and I think will continue to be engaged. But definitely the priorities need to be set or reset by the community, especially if there's a change, right? So if there's a shift in policy windows, or if there's a shift in needs in the community, those need to be prioritized before going back to lobbying or having briefings with elected officials.
That is great. And just a special shout out to those stakeholders that are actually here in the room today. I know that 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 demonstrates a commitment to this kind of work by the folks that showed up, that are stakeholders in the community and interested in the findings and engaging in these conversations. So thank you all that are here, that are making a difference out there. Okay, so we have about, I would say about 10 minutes or so for questions from the audience. So please feel free to use your raise hand function. And if not, put your question in the chat there, and we will get to your question if there's time. Okay, and I know we already had a question from Melissa Smith. Did you want to ask?
Good morning. I am so impressed with your dissertation. Your research is just incredible. What a contribution. So thank you so much, Mario. And I wrote my question in the chat, but I'll read it. I appreciate your focus on decolonized and participatory approaches to your research. I also appreciate elevating the importance of community capacity building around health equity. What thoughts do you have about the potential impact of expanding training opportunities for community members themselves to be trained in community-based participatory research focused on health equity?
Thank you, Melissa, for your question. I really appreciate this because a lot of this journey first started in that class I took with you and with CVPR methods. And I think that my thoughts is that we need to expand trainings to our community members through these sorts of trainings in health equity, right? There's a lot of legwork happening in our state capital on increasing the paths to career education in the health workforce, right? The California Medicine Scholars Program is something that I'm thinking about all the time. So I believe it's SB40. And so I think that with that potential and also the other potentials in networking with community colleges in the area would be a perfect way of engaging with local community members who are on the ground, who are from the area and have a stake in health equity in our county. And I think that's one of my visions for expanding training to community members in CVPR on health equity is bringing in people who are not the primary focus of research institutions, right? And collaborating with people in the community college. And I think there's a lot of buy-in, right? And especially now when we live in an area where people have to travel for their medical care, right? Sometimes as far as Los Angeles or Stanford to see a specialist. So I think that in expanding training in CVPR, people will start to realize that, right? That there is a very apparent need to bolster our health workforce, but also to have more people to be keen on health equity and how we can work together with community members who have such valuable knowledge and expertise already to share with us.
Thank you.
Thank you for your question. Are there any other questions from the audience? Okay, so being that there are no more questions from the audience, if any other question comes up for you audience, feel free to put it in the chat. We will do one if there is any other questions from the committee members. If there are any questions from them, we'll do another round of questions, and this time we'll go in the reverse order. So I'll start because I had a question that was left open for me, but I wanted to make sure the community had a chance to ask questions before I followed up with this question. And it has to do, so I started the defense by saying that you are an incredible shapeshifter. You're able to blend in and excel in multiple arenas, being the academic world, the political world, the organizing world, the community world, and so many other worlds that you're part of. And I'm just wondering now in terms of, and you've talked a lot about the policy world and the community world, and I'm wondering about the theoretical world. I'm wondering if I could, push you a little bit in, further developing your concepts. What concepts have you been working with to develop a framework, right? That's your own, that has to do with bridging the decolonizing methodology, the Latino threat narrative, the response to that Latino threat narrative, the community agency involved in that response, and how it seems to me that there's a thread here, and the thread is that the more multicultural the community gets, the more that the community involves itself in networking with each other and providing culturally responsive opportunities to each other to access resources, the better that community gets at collective self-efficacy, at being able to make an impact and make a difference. I'm wondering if we could get you to give me a concept that would be sort of the umbrella for all of this process taking place.
Yeah, so I'll start with decolonial inspired methods, which was actually accepted and is forthcoming in the New Directions in the Evaluation Journal. So I think I would definitely continue to further develop that after publication as well, in thinking more about how this gets complicated with indigenous peoples who are basically settling on other indigenous peoples' lands, right? That Dr. Miley Blackwell makes an excellent point in complicating the relationship between Latinx indigenous migrants and Native Americans from here in the United States. And so I think I would definitely want to explore that further using that lens and seeing how those sort of interact and like what is to be said about our collective solidarity as indigenous peoples, as well as acknowledging our differences and how we work together and put forth these theories. I think another one that I want to mention is the movement pandemic adaptability. that paper is under review, and definitely I want to explore more what with Verta's suggestions in how this essential framing, how it is operationalized, what its origin is, and what its impacts have. I think that many social movement scholars could benefit from reading an article that is developed from a grassroots point of view. And I think that that's the strength of this theoretical component, is that it's a movement pandemic adaptability. It's meant to sort of reflect the shape-shiftiness of organizing and adapting to a crisis, right? Verta has a lot of experience with this, with her own dissertation, right? Both of these works come out of crisis, and I think that will be a good thing to further develop as the years come, because this is likely not going to be our only pandemic, right? In our current like global crisis. And then I also wanted to lift up the mental health pyramid that's actually forthcoming or under review with psychological services. I got an email from them that we would probably hear back in 2 weeks about the decision, but that's the more of a theoretical work that'll be useful for practitioners, right, in mental health care delivery, as well as local organizers, right, and what priorities need to be centered for transforming the way that these services are delivered. And lastly, immigrant policy is health policy. That one is being reviewed by Health Promotion Practice. And that was the one with the network analysis and the newspapers. So I think that one has, the content analysis and the newspapers, that has a lot of potential to be ironed out and also develop other sort of publications, or even contribute to media, right? Media studies on what are the things we need to be thinking about in publication, right? How do your words affect and form culture?
Wonderful, thank you. Any final question or comment for Mario, Professor Tellez?
No, just congratulations, Mario. I mean, this is amazing because it's, you're also developing this, like Victor said, methodologically and theoretically, and you're keeping on doing that. But I think just, the applied contribution, and this is definitely applied sociology, and you're introducing critical perspectives to that, I think is just as an enormous contribution.
Wonderful. And Professor Taylor. Let's get you unmuted, Professor Taylor.
What's next on the job market? So now that things are opening up a little, let's talk about where we expect what you're gonna do next, huh? This is all such great work, and we don't want to see you lose momentum.
Yeah, so the job market has been a very eye-opening experience in terms of finding a job during the pandemic. Many of my colleagues and peers have found assistant professorships at universities nationwide. And because of the nature of the job market, I chose to stay local for just to finish out some of these relationships and work. So I'm working with Future Leaders of America as a health equity policy manager right now. And that's been more of an on the ground sort of experience in organizing and research, but I've been also using my research to actually advocate on the ground. Like, for example, in Santa Barbara, my research skills helped to contribute to the deemed approved ordinance public comment by creating like a one-pager with all the facts around, criminal activity related to drinking in Santa Barbara. So there's like this big concentration in State Street and the Funk Zone, right, that actually is correlating with policing communities of color and low-income communities in Santa Barbara. So I think I'm just spreading my talents around right now to sort of bolster the policy advocacy locally. And then I'm looking to hopefully get a position as the inaugural ethnic studies faculty at Cuesta College, which would allow me to develop and build a department focused on applied methods in ethnic studies, but using my sociological practice, right, to inform those decisions as to educational leadership, right? I want to make sure that we have a department that is sustainable and is beneficial to the folks that they're serving. So I think really it comes down to, where do my skills make the most sense to be used, and how will they be used to continue doing this practical work that's useful to communities. So I think building the next generation of leaders who are cognizant of indigeneity, of sexuality, of gender, of just all of this wealth of knowledge that I've learned at my time as a sociology graduate student is going to be very beneficial for our future, because we're going to be building those leaders, right, who are going to be leading politics, who are going to be founding different nonprofits and foundations, et cetera. And I think that's where I see myself at the fore, is actually having a say in how our leaders develop, have a broader impact.
Good, good.
Wonderful.
Well, congratulations. Good luck on the quest to college. When will you know about that?
My interview is tomorrow.
Oh, God, good luck.
Good luck.
Good luck.
Yeah, and that'll actually allow me to stay in the area a little longer to finish up the book manuscript. I expect to be working on that in the year to come. And I have another couple of collaborations brewing as well that will be,
Great.
my style, right? Covering the Central Coast rather than just one location, and having an impact for our youth of color.
Wonderful. And you started your higher education journey at Cuesta College, correct?
I did.
Yeah. Whoa. So Mario told me a story about when I first met him. Mario didn't go straight after high school to college. He worked full time. And but after a while, he decided it's time for me to head back. And he heads back to Cuesta. And I remember you telling me a story, Mario, that it was like this really disorienting experience. Like you didn't know where to go. You were a little lost. And the people there started to guide you and mentor you. And that's what made a difference in you returning and sticking to higher ed, then transferring to Cal Poly San Luis Obispo, still doing your grassroots organizing, community and school organizing, and then going on to receiving prestigious fellowships and at UC Santa Barbara. So it's been a beautiful journey that you've had. You've been resilient, you've been strong. This is wonderful, full circle. So again, congratulations, Mario. The committee now is going to be sent to a breakout room where we're going to discuss the work, discuss our ideas, our thinking about where Mario, will go next, and then, of course, come up with a decision on the defense. All the formality, of course, but it has to be done. So we'll get beamed over to a breakout room. We'll be back, no more than 12 minutes, okay? It'll be less probably. So if Alex, if you can magically beam us over, that would be great, to a breakout room. Second. Oh, here he goes. Hey, Alex, just wanted to we're ready.
Okay, cool. I'll bring you back in.
Thank you. Oh, here we go. Leave breakout room. Okay, we're back. Well, we're on our way back. We'll all be back soon. And we'll wait for Verta. There we go. All right. Well, congratulations, Mario. You have successfully defended your dissertation, and we are all thrilled about your incredible work. Felicidades. Thank you to the community members that have supported Mario. Thank you, committee members, for your hard work. Thank you to everyone for being here for him. Dr. Espinoza Kulick.
Congratulations, Mario.
Congratulations.
Thank you, everybody.
Yes, congratulations.
I want to read a special thanks and dedication for this moment. I really appreciate becoming Dr. Espinoza Kulick. It's been such a journey. I dedicate this dissertation to my father, Juan Espinoza. His last words to me were, "Échale muchas ganas en la escuela, mijo, supérate," which means give it your best in school, son, better yourself. And these words have motivated me to continue to persevere, succeed as a scholar and community leader. This project has also, Latinx Immigrant Indigenous Health honors his memory and my family and our experiences. So I would like to thank my mother, Josefina Espinoza, as well as Maria Nena Viveros, Luis Hernandez, Juan Espinoza Jr., Maria Flores, and Danny Espinoza for their support and solidarity, along with my entire extended family. I also like to thank Monique Kulick, Jonathan Kulick, Mike Kulick, Chelsea Kulick, and Finn Kulick for their encouragement and care. And I couldn't have done this without my family. I'm deeply, deeply grateful to my husband and partner, Dr. Alex Espinoza Kulick, and our fur babies, Tigro, Nina, Moana, Taco, and Tank, who were there with me every step of the way. To the community members, leaders, advocates who participated in this study through interviews, focus groups, the survey, our conversations, collaborations, and the fierce advocacy and resiliency in our community. Y'all are just such a constant source of inspiration. And this project belongs to the community first and foremost. La Gente Unida is a platform that has allowed communities to benefit from your collective knowledge. And also thank you to Herencia Indígena for providing Mixteco interpretation services today and at the community talk. And thank you to my dissertation committee, especially my chair, Dr. Víctor Ríos, for his unwavering support, and committee members, Dr. Verta Taylor and Dr. Edward Tejes, for their consult and advice. I would also like to express my deep gratitude for Dr. Melissa Smith, who emphasized the importance of working directly and authentically with community members and partners. And I also benefited greatly from the hard work of undergraduate research assistants like Elisa Gonzalez and Jodine Takahashi. I want to express my appreciation also from the Health Policy Research Scholars team, Dr. Keisha Pollock-Porter, career coaches Dr. Margarita Lightfoot and Dr. Ernesto Castañeda, and my coach, Shemeka Ebony, as well as the program staff and cohort. As everyone can see, this isn't just a one-man show. Dissertations are created by individuals who, not just individuals, but strategic networks, partnerships, and mutual trust. Thank you.
Thank you, everyone.
Thank you.
Congratulations, Mario.
Yes, congratulations.
Congratulations, you did it.
Thank you.
Yes, and great. I'll be happy to read any of these articles on social movements when you're ready to run them my way, okay?
Yeah, I'm looking forward to it.
Okay, all right. It's not, his mentoring is a lifetime relationship.
Yes.
Right, okay, bye.
Bye.
Oops.